This is CCTA case number 23. The history is that of a 55-year-old man with an abnormal stress test suggesting anterior lateral myocardial ischemia. Let's begin by looking at the left main. There are three phases for review here. These can be changed by moving the next or the previous button on the cine control. Let's concentrate again on the left main. You can see there's some calcified plaque. Let's rotate around this area. Probably some loss of lumen in this area. I would say probably about 50%. Sometimes if we change the window and level a little bit, we can broaden out the window a little bit. We can begin to kind of tone down the amount of calcification, get a little better idea of this area. But the left main here clearly looks like it may potentially be compromised if we switch to an NPR view. Again, very difficult to see the lumen very well. Switching to another phase doesn't seem to really help. So right away we've got a potential obstructive lesion involving the left main. I'm going to switch to the MIP view. Let's take a little better look at the rest of the vessels. As we look at the left anterior descending, there's clearly some mild proximal disease. Let's make this just slightly a little bit bigger. Clearly some mild proximal disease, but as you proceed down into after the first diagonal, there is basically a total occlusion of the mid left anterior descending with the non-calcified plaque. There is some mixed plaque a little bit further downstream of that. There is some faint flow involving the second diagonal and even the left anterior descending. Likely this is due to some collateral flow, although as I pointed out in the past, you can't tell antegrade from retrograde flow with a CT scanner, but given the fact that we have likely total occlusion here, this is probably a collateral blood flow into those distributions. Let's take a look at the circumflex vessel here as we proceed down to look at that vessel. We can also see here some area that looks like focal obstructive disease in the more proximal segment. This is kind of mixed calcified, non-calcified plaque. Switching to another phase just to be sure that we're seeing the same thing. Clearly appears to be obstructive disease involving this portion of the circumflex. There is flow down into the OM1, however. Let's take a look at the right coronary. There is some mild non-obstructive plaque involving the proximal segment. As we proceed down, though, it becomes a bit more difficult to look at that. You can see that there is some motion blurring. Again, trying to see if another phase will be helpful. Sometimes there is, sometimes it isn't. This appears to be likely non-obstructive in my opinion. It's still the lumen appears to be of adequate size, although some people would call that borderline. As we move down further into the vessel, though, there is another area here of non-calcified plaque that also is somewhat eccentric. This is a bit more difficult to determine whether or not this is sort of a borderline situation. Let's look at the rest of the vessel now as we try to rotate around here. Clearly diffuse disease involving the remainder of the vessel. There's good blood flow, though, down to the distal aspects of the vessel, posterior lateral, and also what appears to be a posterior descending vessel that actually appears to be relatively normal. So in summary, we have a patient who has probably left main disease, clearly obstructive disease involving the left anterior descending, obstructive disease involving the circumflex, and even a borderline obstructive disease involving the mid portion of the right coronary artery. So this patient has left main with double vessel disease, possibly triple vessel disease, and should proceed to coronary arteriography for further mapping, and then possibly consideration for an intervention such as coronary bypass surgery.